In our presentation, we will be elaborating on how an everyday device, such as a sphygmomanometer, uses fluid mechanics to operate. This is a sphygmomanometer, and most individuals commonly refer to it as a simple blood pressure monitor. No matter who you are, you have most definitely seen this device at a doctor's office, it being used by your parents or grandparents, and perhaps you may even have used it yourself. Today, we'll be explaining how this device is able to estimate one's blood pressure by looking at the origins of this blood pressure monitor and seeing how the initial design has changed over time to get to where we are today.
The origin story of the first modern blood pressure monitor began in the early 1600s when Dr. William Harvey published his work on the body's circulatory system. Later on, in the early 1700s, the correlation between heart rate and pulse was discovered. Using the information that came before him, Reverend Stephen Hales took the first blood pressure measurement on a horse in 1733, as shown by the picture on the right side of the screen. All of this led to the invention of the first sphygmomanometer in 1881.
The first blood pressure monitoring device which did not intrude an individual's artery was developed in 1855 and is showcased at the top left of the slide. This device compressed arteries with weights whilst measuring the pressure required to stop blood flow in the individual. This design was eventually improved upon in 1860, where a sphygmograph was utilized to record pulse by measuring a water-filled chamber in which pressure levels could be changed, and a manometer was used to record the blood pressure. Moreover, this led to the development of the modern sphygmomanometer shown at the bottom left of the slide in 1881 by an Austrian physician named Carl Samuel Richard von Bach. The initial design consisted of a column of mercury connecting to a rubber bulb which was surrounded by a water-filled bag. This device was then placed on the brachial artery of a patient, and water was pulsed into the bag until the pulse of the patient momentarily stopped. The height of the mercury column was then recorded in millimeters as the systolic pressure. This paved the way for the mercury sphygmomanometer to become the gold standard for blood pressure measurement for a majority of the 20th century.
The evolution of blood pressure monitoring has surprisingly had very few impactful advances over the past few centuries. In 1881, the first clinically applicable sphygmomanometer was invented. It used a round dial that provided a pressure reading, as seen in the first image. In 1896, the device was improved, the main improvement including a cuff that could be affixed around the arm to apply even pressure to the limb. This would become the standard design for the device in the future, as seen in the second image. In 1905, modern blood pressure measurement truly began, when the difference between systolic and diastolic blood pressure was discovered. This discovery was incorporated into future versions of the sphygmomanometer, as seen in the third and final image.
In many cases in our Physics 131 class, we use the pressure equals force over area formula to find the pressure in a system, but in the case of blood pressure, this is impossible. Instead, we utilize a device called a sphygmomanometer, which we have been talking about during our presentation. Blood flow in human arteries is laminar, but it can be turbulent if a narrow restriction occurs in one's artery or if a branch point is reached. And just as a reminder, laminar flow occurs in parallel layers, whilst turbulent flow is characterized by chaotic properties. In general, turbulent flow increases the perfusion pressure in an individual, which is a very bad sign for the person. The force needed to close a brachial artery is then compared with the already known force measured by the rubber cuff, and the height of a column of mercury in a typical manometer dictates the blood pressure of an individual. Initially, the pressure in an inflated cuff required to close a brachial artery is greater than the systolic pressure, which is defined as the pressure in the artery walls when the heart is beating. As the cuff slowly deflates, the turbulent flow occurs in the growing narrow gap produced by the loosening of the cuff, which in return produces chord cough sounds. Chord cough sounds continue to occur until turbulent flow stops, which indicates that the pressure in the rubber cuff is less than the diastolic pressure, which is the pressure in the artery walls in between heartbeats. For instance, if 120 millimeters of mercury is the pressure at which chord cough sounds begin, and 80 millimeters of mercury is the pressure at which chord cough sounds stop, then a person has a blood pressure reading of 120 by 80, and this is always read by systolic followed by the diastolic pressure.
Make sure to pause and read this slide to see how to properly set up and use a blood pressure monitor.
And this concludes our presentation regarding sphygmomanometers. Thank you for listening to our presentation.